Ringworm. Ringworm, as I just talked about earlier, it's not a worm and it often doesn't show up as a ring. It's a fungus that lives in your pet's hair follicles. Definitely more common in cats and most common in kittens. And most of the time what it's showing up as is areas of hair loss. So I'll see these more commonly. Young cats come in, generally a year and under. And it is contagious, so it can show up in dogs, it can show up in other animals such as horses. When I was in veterinary school, I had ringworm myself on my arm from a horse that came in with ringworm. It's just this fungus living in the hair follicles causes the hair to fall out. Generally, we're seeing in animals that are either have a developing immune system, that's we're seeing young animals, their immune system can't fight it off, or they're immunosuppressed, they're sick in some other way. In most cases, it's localized, so we have, I'll typically see it in cats. I might see it under their ears, this area of hair loss. Maybe the side of their face, sometimes their paws. The diagnoses, initially it's the hair loss. We're in other cases of hair loss. Your veterinarian will have a thing called a Woods lamp, which fluoresces. And unfortunately, this fungus will actually fluoresce green with the light shut off. The biggest thing, so it's a black lamp. They just have to make sure it's plugged in and warmed up before they test it. In most cases, you can diagnose it that way. As well, too, to confirm it, you can actually pluck strands of hair from the localized area. You can actually grow the fungus in a little fungal thing called a fungus A. And, in a short period of time, there'll be a color change. It will diagnose that your pet has this fungus or ringworm. The biggest things in terms of treating it, one, knowing that it can be self-limiting. So in most cases, it's going to go away. Secondly, too, we want to apply things topically that are antifungal and see if we can avoid some of the conventional medications. There are things like, there's one called griseofulvin, which in some cases, unfortunately, you just have to use when we've got sort of generalized ringworm. But just knowing there's some pretty serious toxic medications, as is most of the antifungals. So they're really great ones to avoid if possible. So some of the topical things that I like to use. Some of the easiest things, I just don't have it here with me. The second would be vinegar. Vinegar is antifungal, so you could apply it. You can get just acetic acid or vinegar wipes, or you just put some vinegar on a cloth, and just be wiping that area of your pet's skin twice a day with vinegar. The shampoo that we talked about earlier, this Dermazol, so it's a 2% miconazole antifungal shampoo for dogs and cats. I would advise you using that from your veterinarian, so much safer than using the conventional tablets, if you can. Because we know we're dealing with your pet's immune system, also anything we can give that's going to potentially get their immune system working more effectively and potentially fighting that fungus is ideal. So something like Echinacea orally, you can use a tincture, 1 drop per pound. Twice daily, the tincture work very well. Some of the other immune stimulants that we just talked about, astragalus, same thing. You can use that as a tincture as well too. And the one last thing I'm advising to is getting your cat on some type of fish oil supplement, which seems to be beneficial as far as anti-inflammatory and also being somewhat making the immune system being more responsive. In all ways, knowing, first of all, it's recognizing their hair loss, getting diagnoses, and then being on top of it, and really starting strong with the topicals first, more specifically the shampoo, or just like we're topical vinegar first, and trying to avoid those conventional oral tablets.